Good afternoon, ladies and gentlemen. Happy to be with you today in the World Heart Day, 29th of September 2020. And I am Dr. Mohammed Fathi. I'm a cardiology specialist in Midcare Hospital, Sharjah. So actually, I have a good experience in cardiology since over the 20 years. And actually, this experience led me to have also knowledge about how to manage the different diseases related to the heart and also how to promote the health of our patients. Today, actually, we are going to try to give some awareness for our patients about the heart and how to take care of their hearts. Actually, the heart, in my opinion, is the most important organ in our body. And actually, that's why we are trying to take care of it as it's a lifelong organ. Actually, we cannot really replace it and we cannot really repair it again if there is some damage to happen to it. So the best way in order to keep our heart safe is to prevent actually diseases from happening to the heart. Many diseases happen to the heart is related to our lifestyle, our actually diet or our food, lack of exercise, and also some related to the smoking, related also to the genes or some inheritance from the family. So actually, we have to try to tackle all these things and try to reduce the risk as much as we can. And how to do this? Actually, the most important thing to take care of our heart is the early detection of the cardiac disease. So usually we can start to do this in the 30s and maybe in the 40s, but actually 30s is the best time so we can check our cholesterol, our blood pressure, our sugar status, and also if we have a family history of heart disease, I think this should be done earlier than that. Management of the cardiac disease nowadays is more and more easier and more convenient than before. And actually, there is some myth with some of the patients that they think that taking medications early is bad or it will cause some side effects to their body. But actually, in the contrary, taking the medications early as much as we can will protect our heart from atherosclerosis and the blockage of the arteries, and also can protect our hearts from hypertension and the deleterious effect that it will cause to our hearts, kidneys, and brain, for example. Check also for the cholesterol and manage it early. All these things are actually very important in order to protect our heart early and prevent the cardiac disease from happening. So medications is not bad when it's taken by the appropriate doses. And actually the follow-up for those medications and for those conditions is very essential because actually those are a chronic disease, things that will be going on for life. So hopefully we will take the medications as the doctor is directed and keep it on and actually follow up with a doctor in order to protect our hearts from any harm or from any disease. So actually I have now with me Ahdeya, and she is our marketing assistant, and she will have some questions from the audience and we are ready to answer them. And I'm actually also open if you want to, either in English or in Arabic, we can really reply to any of your questions happily, inshallah.
Thank you very much, doctor. Hope everything is good. I just want to say sorry to our followers and viewers. We just started a bit late because we had some emergency cases with Dr. Fahi. So hope everyone is here and let's start our live. So doctor, you mentioned about disease and Corona time, as we're living now in Corona era.
Yes.
So what you can say about the type of cardio disease we might have, and maybe age differentiations and
sure.
So
It's a very good question, Ahdia. Actually, the thing is that the coronavirus is actually affecting, as it affects the lungs, it affects also the heart. So we have to be careful that not only it's only affecting the lungs or maybe the throat or whatever or the upper respiratory tract, but actually it's affecting also the heart. It can damage the muscle of the heart. And actually, yes, the virus can damage the muscle of the heart and actually can make the heart weak. And patient can get into what you call heart failure.
Okay.
So actually, usually the patients with coronavirus, part of their investigations, we're doing this troponin, which is one of the cardiac markers. And also it should be actually patients who have any symptoms like persisting after the corona. He is getting well after the corona and he's negative PCR, but actually still having some kind of shortness of breath. We should really be seeing this patient, doing an echo for him, checking his heart, actually because there might be, God forbid, some damage happen to the heart. So actually this is one entity during the corona era, as you have said. Other thing is that during the lockdown and the people now are also afraid to go out and so on. So there's a lack of cardiac lifestyle, like cardio exercises and walking and going to the open air or gym or whatever. So actually this will induce many problems. First of all is the obesity.
Okay.
People start to get overweight, and this is actually a burden on the heart.
It's very common.
Yeah, it's very common, really. People, we see this every day in our clinic in Sharjah, and we all advise our patients that we should really start, whether now is getting well and is getting better, so please go out, start to walk around at least an hour or 45 minutes per day. This is very important in order to actually start to lose the weight and reduce the obesity. Also, their cholesterol starts to go up. The blood pressure starts also to go up. So all these things actually will be affected by the lack of physical exercise.
Okay.
So it's better also that people start to exercise and increase the physical activity in order to reduce the cholesterol, reduce the blood pressure, and reduce even their sugar levels. Other issue also, people also get stressed nowadays also because of different issues, financial or whatever. So the thing is that this is also related to this corona time. People are getting stressed, and also stress is also affecting the people's heart. It can induce, ischemic heart disease. It can increase in the blood pressure and so on. So actually, this is in the era of corona. Actually, the need for cardiac care is getting more and more, and the need of cardiac advice is getting more and more. So hopefully, with our patients, that they start to adapt a healthy lifestyle and start to do more exercise and also to follow up in the clinic in order to get more and more advice regarding their conditions.
We hope so. Everything will be good and
Yes.
everyone will stay happy, safe, because Corona
Inshallah.
is treating everyone different way.
Yes.
So I want to thank the followers and viewers today because they're very active in social media, and we have a question regarding, we talked about a bit earlier about the weight.
Yes.
When we're gaining weight, it's affecting our heart. So
Sure.
what can be other cause of to get a heart disease?
Actually, also it's related to the situation that we're having. Also, is the smoking. Smoking
Okay.
is one of the big risks that we face in the management of our patients, because actually people are maybe are working from home,
Okay.
as we can say, and this is staying at home will not make them go out a little more, and actually they will smoke more because they're sitting at home, nothing to be done, so they'll start smoking. So smoking actually affecting the heart in various ways. Actually, there is nicotine, which is actually a very potent vasoconstrictor, which will actually constrict our arteries, the coronary arteries, and can induce heart attacks and ischemic heart disease. Also, the tar present in most of the smoke, as you know, it will induce also some kind of a bronchospasm. The lungs will start to be, unable to take enough air, and all these actually will be related to the cardiac disease. So oxygen starts to get less, and there will be a big problem really
With the heart.
for the patient. So in addition to the obesity, Also, smoking is the other big issue that we should really target. Also, yeah, there is some also the alcohol, if it is consumption of alcohol, also if it is getting more than the appropriate or the usual levels, actually this can induce also cardiac disease. So actually it affects the heart, and it can be part of the problems that we can face with our patients.
Okay.
Yeah,
So we can suggest our patients, people who is seeing us, that please follow a bit as much as you can the healthy life, so you will not face all those problems later.
Good.
And inshallah, hope everything will be good. So regarding the heart pain, as far as I know, there's a different type of pain we're feeling when it's related to heart disease. So you can give us a brief.
Sure. Actually, the chest pain, or we call it the heart pain or the chest pain, actually there is many causes for that.
Okay.
It might be related to the heart, it might be related to the abdomen, related to the stomach, related to the lungs, chest wall, muscles, many things. But actually, the main thing that we should really take care of, if we have a pain in the center of the chest, okay, and it's related to the left side of our chest, okay, or to the left shoulder, back, neck, or even the stomach here, the epigastric area, this is usually related to the heart, okay? And the character of the pain also, because actually the character of the pain differs. You know, if the pain is like a squeezing pain or compressing pain, and also associated with other symptoms, like, you know, a patient is sweating or feeling shortness of breath, okay, or his heart is racing or going high. Actually, all these things are related to the heart. In this situation, if you feel a pain like that, you should really try quickly to go to the doctor, and before that you can maybe take an aspirin, one tablet, or you crush it and you can have it and go to the hospital, so you can be examined and you can be checked, see if this is related to the heart or not, and you should be given the proper medical treatment. Because actually, if it's related to the heart, the time, we say, like in the normal life, we say time equals money. Yeah. In cardiology or in heart disease, we call it heart equals muscle. Yeah. Because once, if there is kind of damage to the heart, it will not be replaced again. And the sooner you go to the hospital, the better the outcomes and the better we will save your heart.
That's beautiful.
So that's why. So actually, if the pain also is persisting more than 5-10 minutes, or it's related to effort, if you go climb stairs or you walk and you feel the pain, this is also related to the heart. Okay, if you feel this pain in a cold weather or when you are getting stressed, this is related to the heart.
Okay.
So all these pains are related to the heart. It might be related to other issues. There might be other causes, like, you know, something from the stomach or the esophagus, whatever. But actually, as you know, we cannot really, take it for granted, or some where you say, yeah, it's only for stomach or whatever. Check first your heart. When your heart is okay, everything will be fine afterwards. It's easy to manage other things, but you have to check the heart.
Okay, that's beautiful. Doctor, thank you so much for giving details, because it's very important. Sometimes we have those pains, but we don't know to what we have to consider.
Sure.
And one time away. So heart sound. Is there any kind of terminology for that, or?
Yes, actually, a heart sound. Usually we are not hearing our heart sounds.
Okay.
Our heart is beating all the time, 24/7, for the whole life, and we are not hearing it. This is the normal thing. But once we hear our heart beats, we call it palpitation.
Okay.
So this is in the terminology for hearing our heart sounds. Palpitations mean that our heart rate can be fast,
okay,
or can be slow,
okay,
or can be irregular.
Okay.
So once we have these abnormalities, we will hear or we will feel that we are having heartbeats.
Okay.
Okay. So actually, also this is a problem, because this is not normal that we hear our heartbeats or feel it.
Okay.
So it might be many problems can be related to that, either related to the heart or related to other things. For example, not related to the heart, if we are having fever.
Okay.
we will have high heart rate or we feel a heart rate. Anemia, which is low hemoglobin, can cause that. Pregnancy can cause that. Hyperthyroidism, which is increase of the thyroid hormone, can cause palpitation.
Okay.
Yeah.
That's very good to know.
Yeah, not sleeping for enough time, okay, can cause this. Drinking tea or coffee for big amounts, 5, 6 cups per day, for example, can cause this. So all these are related, actually increase the heart rate or making kind of abnormalities or skip beats.
Okay.
So at that time you will feel the heartbeat, and at that time you should really check your doctor or check the cardiologist in order to do some more investigations like ECG, like Holter. All these things will be done, and some also blood tests, so we can know what's the cause of that and we can manage it efficiently.
Okay, that's beautiful.
Thank you.
Doctor, there is a question, I don't know I will pronounce it correct or no, but can we give a brief information about tachycardia and bradycardia?
Yeah, this is what we're talking about,
Okay.
tachycardia and bradycardia. Tachycardia means that heart rate is too fast,
Okay.
and bradycardia means it is slow.
Okay.
So tachycardia and bradycardia, as I told you, it's related to either problem in the heart itself or something outside the heart, okay?
Okay.
So it has to be investigated by doing the ECG and the Holter and other investigations, so we can really know what is the cause of the problem and manage it efficiently. Is it from the heart, so we can manage it, or related to other things like, as I told you, anemia, thyroid problem, fever, whatever, so we can really manage the patient. Sometimes even if there is a kind of a bradycardia, if they want to know the name, bradycardia is slow heart rate.
Okay.
Sometimes this happens also in thyroid problem, and sometimes with old age there'll be kind of fibrosis of the systems inside the heart, the conductive system inside the heart, and we need to put what we call a pacemaker sometimes.
Okay.
So this is have to be decided by the cardiologist when they do the Holter and see what's going on inside the heart.
Okay, it's very good. One question, just on topic we're talking from beginning, we mentioned there a medicine called aspirin. So it means that there is a medication treatment before to go to doctor, right? I mean,
Yes.
we can have at home just to predict some
Sure.
heavier situations.
Sure. Actually, aspirin has shown that if the patient is having a heart attack,
Okay.
and taken on time, just having the pain, it will reduce much of the impact of the heart attack on this patient. Because actually what happened in heart attack is there will be a kind of blockage in one of the arteries, the coronary arteries with blood clot, okay? So actually it's like a cascade. The blood clot will start to form, and it will be going on and on and on and block the whole artery. So if we take an aspirin, for example, 100 or 200 milligrams, or usually we give 300 milligrams, crush it and under the teeth, and we are actually swallowing it, so it will be absorbed quickly. This will reduce the acceleration of the clot formation, so it will not block quickly the artery. So this will save the patient from having a blockage and damage for the heart. So taking aspirin is very, very, very important.
Okay, that's beautiful. Our follower thanking us for, he will stop his coffee and he will go and do his test. So thank you so much for being active, and we
Happy
really
for you.
appreciate.
Happy
Yes,
for
we
you.
appreciate your feedbacks. By the way, if you want to book an appointment with Dr. Fathi, please, you can contact Medcare Hospital Sharjah anytime, and we can book your appointment directly.
It's our pleasure. It's our pleasure always.
Yes.
To serve our patients.
Yes. So while doing cardio exercises, what is the normal heartbeat? So
Good.
this is a question in our Facebook page, that while doing a cardio exercises, what is the normal heartbeat?
This is a very good question. Yes. Actually, we encourage all our patients, as we have said, to do exercise and do different kind of exercise, which is cardio is the best for us, like jogging, like swimming, like rowing. All these, the cycling, all these are very good, actually, very good exercises that we really appreciate in our patient. If we're going to do an exercise, actually, it depends on the age of the patient. So actually, usually we have a formula that we utilize. It's about 220 minus the age of the patient. So actually, if, for example, the patient is 40 years, for example, we will take 40 from the 220, so it will be about 180.
Okay.
So the patient can reach heart rate of 180 if needed. But usually we're not recommending that. We're recommending to reach 85% of this figure. So that's about, you can say 165, 160, 150. Heart rate can go to this and safely, there will be no problem. If you're doing exercise and you reach this 85%, for example, and you felt that you're not comfortable or you feel pain on the chest, this means you have a problem in your heart. You have to stop immediately and contact the cardiologist. So this is according to the age of the patient.
Okay.
So it depends on the age. The younger you are, the more you can really run. You can really reach, for the younger generations, 20, you can reach to 200 or 190. It's fine for with them. Because actually it depends on the age. The older we get, actually the less we can increase our heart rate. But if we reach to this heart rate, as I told you about this formula thing, if you're reaching that and you felt any chest pain or any discomfort in the chest, you're feeling not well, you should really stop the exercise and you should really contact the cardiologist. Because actually we see, and actually it's a recommendation also now, that if you're going to start to go to the gym and your age is about above 40 or something, you have really to go first to the cardiologist, assess you, see how the situation is, see how is your heart functioning, and if it is fine, you can proceed with he can do we have what we call the exercise stress test. So it's like a gym. You go on the treadmill and we do the ECG and check. Everything is fine. You can go and proceed for your gym and for exercises safely without any problems.
Okay, that's beautiful. So as far as I heard that even now the gyms in UAE, I don't know about the other countries at the moment. So what they're doing, they're suggesting their new members to go and check with cardiologist.
Sure.
Sometimes they have their cardiologist,
yes,
but sometimes they're sending, please check it. As you mentioned, about 40 years old, and which is very, very good.
Yes.
As well about the diet, what they're mentioning too, that
what to eat.
Exactly. Sure. They're making proper, I think.
Yes.
There's a lot of situations happen that people, they didn't take care of this situation and they had a problem.
Yeah, we have many big stories about that. That people go to the gym and start to do exercise and they are not really ready to do this because of any cardiac problem they have, and they have a complication. So better, I advise my patients, my viewers also, our audience, that please, before you go to the gym, if your age is above 40, better you go to the cardiologist, do some investigations, do some stress test, and when he clears you and tell you it's okay, you can proceed with your exercise, and it will be safely for you to go there without any problems, inshallah.
Inshallah. I think as well, it's good to mention that there is a different type of extra products for a gym, the people who is going and training to use it and to get the muscles or those things. So it's better as well to consult with doctor.
Sure,
and
sure.
Go.
Agree. Actually, if the person is doing exercise and he needs to take proteins and it's fine. Actually, he can take. But actually, we are not suggesting to take any steroids. People usually take this, some kind of steroids and sometimes some things like that, which is not really good. But if proteins, you are doing exercise and you want an extra protein, it's okay. You can really take. Okay. It's approved by the Ministry of Health, and they can really take, and it's not a big issue, really.
Yeah. I think that moving in our life, like the way we're moving in our life, is very important. Like sport, gym, whatever is sport activity, swimming is very important too, right?
Very good. Exercise is the most important, entity. We are always encouraging our patient, because heart is a muscle. It's like our other muscles we have in our body. So if you train it well, you are treating it well, you are taking care of it, it will have a good outcome, and the power will be good, and you will live all your life without any problems. We see this in the Western world, actually more than in the East part of the world. When you go to Europe or the UK or US or something, you see that people are having their daily activity is to go out and exercise in the parks and run and so on. Even we see them here when we go to the JPR or this Jumeirah area here, which is near us. They are always exercising and doing this. This is really their lifestyle. But actually, we don't have this lifestyle in the in the East part. We are not that much. But actually, this is really, that's why in the Western world we see that their lifespans are more and more than in our areas, because they are taking care of their heart, they are training it, they are taking care of the food. All these things actually will prolong their life and make it a better life.
I think it's good to mention as well today that a new generation, I don't want to say new generation, but in generation which we're living, in the center we're using a lot of technologies and mobile things, like mobile phone, all those things, and our kids is really addicted to those things, as everyone knows it, and it's not even secret.
Sure.
So what we can do, I think, is better to, and we're not active at all. I mean, we're sitting.
Yeah, we used to go out and play football, run, do these things, but these days people are not really, they're even doing this on the mobile. They are doing races and things on the mobile. So actually we should really encourage our kids. Actually, the also important thing we should talk about is the food. So the quality of food that we are giving to the children is very, very important. The fast food is really, really bad, full of fats and full of salt, which is really also a big, big, big issue, to have too much salt in our food. But actually, if we adapt a healthy lifestyle, like eating more vegetables, more fish, more fruits, this actually will improve our health and our cardiac health and prevent many and many of the diseases that we are facing.
That's beautiful.
Yes. Yeah.
Dr. Fatih, thank you so much for coming today, and it's really, really amazing to talk to you. I want to thank all our viewers, our followers for being with us today. And yes, if you are feeling anything, any symptoms we were talking about today, please contact us, contact the cardiologist, and please present anything that you will stay healthy in your life. So thank you so much one more time, Dr. Fatih.
Thank you so much, our dear audience, and I am wishing you on this day, which is the World Heart Day, September 29th, 2020, happy and a healthy heart all over your life.
Thank you so much.
Thank you so much.